Assalamu alaikum. Welcome to our online session. I am Dr. Nafisa Rashid, Associate Professor and Departmental Head, Pharmacology, Bashundhara Ad-din Medical College. Today I will discuss about diuretics. At first, we have to know what is diuresis. The process name is diuresis and the drugs are called diuretics. Now, what is diuresis? Diuresis is it is a method which means that increase urine volume. Whether due to any cause, if one's urine volume is increased, we call that this is the process of diuresis. Like coffee, tea, etc. causes increased urine volume. These are also diuretics, and diuretics are the drugs which causes diuresis. And what is natriuresis? Natriuresis means increased renal sodium excretion. Sodium is an ion. If it is excreted more than its normal level, then we call this is natriuresis. And there is a important feature of sodium that when it excrete, it always take water with it. So whenever there is sodium excretion, there is water excretion too, and this process is natriuresis. Now, what is diuretics? The drugs that block the renal ionic transport resulting diuresis and natriuresis are called diuretics. That means these are the drugs that causes sodium excretion as well as water excretion too. So here we have learned about three definitions. One is diuresis, another is natriuresis, and another is diuretics. Now I want to discuss you about the classification of diuretics. It is a very important question for your written exam and also for Viva. What is the classification of diuretics? It can be classified in many ways. Number one, according to the site of action, where the diuretics act. And what is the site? It is the different parts of the kidney. It can be classified into site 1, site 2, site 3 and site 4. And what is the site 1? That is the drugs acting on the proximal convoluted tubule. You know that a nephron has different parts. One is proximal convoluted tubule, another is loop of Henle, another is distal convoluted tubule, collecting tubule and collecting duct. And these are spreaded in medulla and cortex of the nephron. And the drugs which acts only in the proximal convoluted tubule, that is enclosed by the glomerulus, are the site 1 type of action, site 1 type of nephron action. Number 1, carbonic anhydrase inhibitor. Number 2, osmotic diuretics. These two type of diuretics acts in this site, in proximal convoluted tubule. What are the name of these? Carbonic anhydrase inhibitors are acetazolamide, dorzolamide, methazolamide, etc. And osmotic diuretics are the diuretics that causes osmosis, and they excrete water by the process of osmosis. We will discuss this later. And now we will learn what are the names of the osmotic diuretics. These are the mannitol, sorbitol, urea, inulin, etc. Now, site 2, that is the drugs acting on the thick part of the ascending limb of loop of Henle. The loop of Henle has two parts. One is descending part and another is ascending part. And ascending part has thick portion and thin portion. And here we will utter that the drugs acts on the thick portion of the ascending limb of loop of Henle. These are called the loop diuretics or site 2. The names are furosemide, torsemide, bumetanide and ethacrinic acid. Now site 3, the drugs acting on the early part of the distal convoluted tubule. These are an important group, that is thiazide group. And the names of the thiazide groups are hydrochlorothiazide, chlorothiazide, chlorthalidone, etc. Now the site 4, drugs acting on the collecting tubule. Collecting tubule, these are the potassium sparing diuretics. The examples are spironolactone, triamterene. So what are the site? There is 4 type of sites of action. Site 1, 2, 3 and 4. Number 1, site 1, there is carbonic anhydrase inhibitors and osmotic diuretics. Here you will see a feature that it is the picture of a nephron, and there is proximal convoluted tubule, and there is thick part of the ascending limb of loop of Henle, and there is proximal part of the distal convoluted tubule, and there is distal collecting tubule and collecting duct. And here is the proximal convoluted tubule. Carbonic anhydrase inhibitors and osmotic diuretics act here, and ascending limb the loop diuretics act here, and in the proximal part of the distal convoluted tubule the thiazide diuretics works in this area, and spironolactone this acts on connecting tubule or collecting duct. Okay. Now another classification is according to the efficacy. According to the efficacy, that means how much water or how much fluid it can excrete. Number 1, high ceiling or a high efficacy diuretics, moderate efficacy diuretics and low efficacy diuretics. High efficacy diuretics, that means its potency or efficacy is very high. It is also called high ceiling, and high ceiling means increase the dose of the drug will increase the level of excretion of the urine volume. That means furosemide, bumetanide. High efficacy, why it is called high efficacy? Because it can excrete 15 to 25% of the glomerular filtrate they can excrete. And what are the moderate efficacy? Thiazide, and thiazide can excrete 10 to 15% of the GFR, and low efficacy diuretics they can excrete less than 5% of the GFR. Low efficacy has efficacy very low, but they are also important because they can act without sparing the potassium, but the other drugs always causes loss of potassium and causes hypokalemia. And you know that potassium is an important ion for our body environment, that if there is any change in the potassium ion, if it is hypo or hyper, both of the state is dangerous for our health. So potassium losing diuretics is important in some cases. Now we will discuss why the loop diuretics are called the high ceiling diuretics. Because number 1, they are more potent, they can excrete 15 to 20% of the filtered sodium and water, and increased dose causes increased diuresis, and they act on the thick part of the ascending limb of loop of Henle, and their mechanism of action is they can block sodium, potassium and 2-chloride transport. Can act also in the severe renal failure and heart failure also. That means when there is a renal failure case, acute renal shutdown, the GFR is less than 10 ml per minute, this type of diuretics can work in that critical condition. And also an important feature, that is it is rapid onset of action. Within very low 15 to 30 minutes they can start their action. Now these are the points you will memorize for the high ceiling diuretics. Now what are the pharmacokinetics of the loop diuretics? I will discuss in my next class that about the furosemide and thiazide. So Allah Hafiz.